fact that I'm living with one form of disability or the other does not make me less human from others. I can be the president, not only a resident here. So give me a chance to show you I can be a governor, I can be the senator, hey. So give me some space to prove it. I can be a doctor, I can be a pastor, yeah. But give me a chance to show you I can be a teacher, I can be a preacher, hey. So give me some space to prove it. There is ability in disability. Give me a chance to show you there is ability in disability. Give me some space to prove it. There is ability in disability. Give me a chance to show you there is ability in disability. But give me some space to prove it. Oh, ability in disability. Oh, just give me a space, give me a space to prove it. They said I'm nothing, yeah. They said I've got nothing to offer. They said there's no hope for me. Oh, just because I'm living with disability does not mean I can do nothing. Disability is a thing of the mind, so don't look down on me. There is ability in disability. Give me a chance to show you there is ability in disability. Give me some space to prove it. The fact that I'm living with one form of disability or the other does not make me less human from others. I can be the president, not only a resident here. So give me a chance to show you I can be a governor, I can be the senator, hey. So give me some space to...
Today na another Saturday. We don't come today with this our Ability Inside Disability podcasts. By now, I sure say now we don't know my name well, but I go talk am again because hopefully with the belief say every Saturday we dey get new listeners. Because now what we want be that make more people they join so that they go to learn, they go to feed, they tell other people where they meet what we they talk about for here, because all of these things that we talk about for here not be only for people who get these conditions and their family. Now for everybody, because what we don't know, we not go know how we go fit the support. So like before I go, as they do every time for here, I go introduce myself. My name now Mrs. Modupe Afiz Ogun. Now me be CEO founder of Beautiful Hands Foundation. And as we know too, Beautiful Hands Foundation now get this Ability Inside Disability podcast. And the reason for this podcast now to talk about all of these conditions, developmental conditions, neurological conditions, where they cause learning disability, where they cause intellectual disability, where they cause problem for our children, where they make it hard for them to read, to understand, to fit take care of themselves, to fit button their shoes, to fit button their shirts, to fit lace their shoes, to fit hold something make it not fall, to even fit talk sometimes, to even fit know say see toilet, go toilet, use toilet, you know, things where other children go do, you know, go even know say they don't do children and adults too, because pikin go grow. Children and adults where they go through, where get these kind of conditions, now all of these kind of challenges now they face. So the reason for all of this our talk now first to make people know we say these conditions they exist. Not be village people carry first bus, can't give anybody. They there, medicine, no am. Don't understand that say this na condition where they come from, something will happen to the brain. So because of that, and most times this condition they know they get medicine. Now management, now you manage them. Manage them with different ways. Now you be therapy, now you be accommodation, all of those ones we go to talk about them. The ones we don't talk before we go re-mention them, because this information must stay with everybody where they hear them, because it is very, very important. So the people where they live with this condition and us, we will know they live with them, because we don't want to be bad people to people where we say nobody can cause what they happen to them by themselves. So today, from what as I know for this program, not be only me the day here. We dey expect our doctors. Mr. Sam no go fit come today, but he go join us next week. Our doctors they come for road, but Oga Boniface in day here. Yes. So I will give him a chance, make him introduce himself as usual. Okay, Oga Boniface. Who be Oga Boniface? Tell our listeners Oga Boniface.
Okay, my people, good afternoon again. We don't come again for this journey where we say we be partner in progress.
Yes,
all of us now partner in progress for this, because if only me they talk, if only us they talk, our voice no go reach anywhere.
Exactly.
The aim of the program be say make everybody join this matter talk. So you did very much welcome. If you did hear my voice, you are very much welcome. We pray say today you go day very interesting past other days, sir.
Yes.
So thank you very much for turning in today.
Okay, my people. Today topic as a day for the flyer. Now waiting be special needs, because I notice say plenty of us they confuse all of these things, because I know say I don't get experience with people where tell me say we don't talk say autism. For example, not be developmental, so they just carry and come off for developmental or neurological condition, carry and go mental disorder.
Immediately.
Even for mental disorder, they not go classify any condition as madness.
Of course.
Because that's a very, very strong word.
They're very strong.
Even though the science fit did there, but because say, as far as the support system there, nobody where condition no go fit improve. You no go fit just give person name where person hear him, you go think say this one life don't final finish, because the word where they come out of our mouth it matter well. Now we they talk about na person they hear him,
of course,
and who they hear him go interpret him. How you go to interpret him, they very, very important. You know, imagine me person talk say because my own pikin get autism, the enemy they mad. You know, even if as person when you understand that condition, even if I go I go feel say, okay, this person no know. You know, remove the pain. Where it go cause. You understand?
Of course.
It go cause pain. It go cause shame. This now for a person like me, where you don't get opportunity to learn about the condition, understand that. What about papa and mama? We don't even know what they do. They are picking.
Exactly.
So you go just tell person, papa, mama say this is picking and mad the math. Why? So because of that, that make me say today topic we go start with make we define wetin be special need, because special need not be madness. So and special need is wide. Abi?
Yeah, of course. Special need, you know this small.
This small, it is wide.
It big.
So and this special need, it cover different areas where if it dey affected for person body. Both the one where you see and the one where you not see. So I go let Oga Boniface make it tell us what is special need be from his own training and experience. Then me, I go come add join him. Okay, Oga Boniface.
My people, make I start like this to explain special needs in the way we be say anybody feel understand.
Exactly.
And
yes. Now what would you do for this program with that?
You feel say special needs. Now people or na condition where they associated or people where they associated with a condition where be say their needs they special. Make I start like that. Their need they special. Now you know me say make you consider them through way the other people we no get needs. No be like that. But you know something where they special, you get how we they treat them.
Yes.
We they give them more attention. So in other words, special needs now people we get needs we need more attention. Now the attention there, the level of attention now him they make the difference.
Yes.
Because why I want to emphasize and I want to use this definition, change our mindset.
Yes.
No be say you get special need pikin, you could come conclude say you get na problem child. Say na problem child. So many people will say na mad pikin like many people they talk. But why they give am this definition? Make you know say waiting that child needs now more attention.
Exactly.
More attention. Even if they give other people attention for house, other of your pikin, then we know to get special. In fact, for me, if I go follow layman understanding or general understanding, everybody gets special needs.
God go bless you.
Everybody gets special needs.
And then I mean from the start.
Everybody get need. Maybe say if you come that side, they need more attention.
Yes.
You understand? Everybody gets one particular area. Some people their own are spiritual issues.
But na need.
They need. If no be need, they no go. They go up and down.
They find solution for it.
You understand? Just like say you get need for health, you go hospital.
Exactly.
Go look for special attention.
Yes.
So you go sit down with doctor. Doctor they talk to you. When they ask you what thing they happen to you, they go run tests for you. Know that one has more attention. You know, you say every day you they take care of your health. No be so. Everybody they take care of them health. You go wash your body, clean yourself, eat clean food, eat better food, put perfume, look nice, come out. That one na care, attention where you they give yourself. But when you can't get issue with your health, you go meet doctor for more attention. So special needs now it refer to group of people where be say if I they talk from my own perspective as speech therapist and also as a special educationist. Special needs now it refer to a group of people where be say they need more attention for their education and their learning. They need more attention for their livelihood. They need more attention to actually do the little things, the small things we be say we feel do. We no go even think them. Yes. But then they need more attention. So now waiting be special needs. Special needs make we they look at from the angle of the level or the quantity of attention we they give person. No be just consider this person you know if you just push on one side, you know if you do no. You know waiting that person fit do until you give him that special attention he need.
You give him chance.
Give him chance. In fact, you get one statement we be say it did for our signboard for that field. I like that statement well.
From Special Olympics.
Yes, Special Olympics. He said, if I cannot I don't know how I go.
Say if you nothing win, then go try.
Allow me make I try.
Allow me make I try. Even if I nothing win medal,
allow me
as a sports person,
exactly.
Allow me make I try.
And for that trying, you go to put all those special needs, all those special attention where the person need. You go see say the person if he do that thing,
yes.
where he be think say you know if he do. So special needs now just people we need special attention
to help them to feel rich where people will not need that attention feel rich.
Exactly.
Abi?
Yes, of course.
So my people, I hope so now understand how Oga Boniface they explain wetin be special needs, because the thinking where they follow children where don't still grow to become adults. Because as we dey talk for this program, not be us talking. Now wetin people where they this field, wetin they don't research, wetin they don't observe, and wetin they exist. We say most of these conditions, depending on the level, now for life.
Of course.
Because this special need condition, they affect everybody where go need special need the same. No. Now levels. We go talk about that one. And also as Oga Boniface talk just now, he say this special need, because special need na cover word, na umbrella word. Now word we define many category of special needs now. So we get physical special need. We get emotional special needs. We get developmental special needs. That developmental own, sometimes they will call it neurological. And sometimes we also get mental disorder. That mental disorder now, that one not be part of special needs. Not part of special needs?
Well, if you check,
it depends.
It depends.
Because sometimes they cross. That is another thing now where our listeners need to know.
Of course.
Sometimes they cross each other. For example now, person will get like the physical special needs category now. Now there you go for see blindness. Abi? Now there you go for see people we know they hear well. Because even this hearing, not be all not they hear at all.
Of course.
Now level too.
We get hard of hearing.
Exactly.
Maybe say they feel communicate with you.
Yes.
To say they go they hear with you, they talk small. You need to speak out.
You need to talk loud well.
They need amplifiers. So that they go feel communicate or hear with you, they talk.
Yes.
Some of them they go they lip read your mouth even as the amplifier they on.
Yes.
So that at least they go they get the main information where they for
where they try to talk.
Yes.
Then we get people where they use where get physical challenges. Where they need wheelchair or some of them need workers.
Yes.
So when we say their condition don't improve past me then sit down for wheelchair, but they still need support for their mobility. They feel carry themselves, but they not feel stabilize. So they're going to use that walker. Abi?
Yes,
take the move. We paste some information for the what is it they call them now? I don't know where they call that one, but they move around there on a fist they check out because this special need classification, where would they do so? It is very, very important because if you don't know now the beginning of how to feel identify.
Of course.
Whether now your pikin, whether now your family member, because if you don't get understanding of some of the characteristics of these conditions, you not go know how you go to make help. You not go know how you go to even do research sometimes because if it be say now you want that environment where you don't understand this thing, and the person where you want to talk to, you notice say they don't want to accept her. So now you will come know say okay I don't hear this thing before. Make her go find some more information, join them. So that I will come now I go fit present them to these people. So my people, our very Dr. Bako don't come now. Yeah, I got Bako, no problem. Sit down. Thank you so much. So you feel come. So you'll be very, very busy person. Today na Saturday for that matter. You do well. Welcome, sir. So Oga Bako, tell us who you be before we continue.
Yeah, my people are all once again. My name is Dr. Bako. If I've been to, I'll be NMA Secretary for Plateau State Chapter, and also I'll be neurologist. Now they try to help people get problem, anything that has to do with the brain, how to help people. Thank you very much.
As we are here just now, Oga Bako, welcome.
Thank you very
As we are here just now, we dey talk about special needs, and we follow talk say under that special need umbrella, we get physical, we get developmental, we get developmental or neurological.
Yes.
Then I can't ask Oga Boniface because two of us, nobody be doctor among both of us. Thank God, say doctor don't come now. So I can't ask Oga Boniface. Mental, what do they call it? Mental disorder. Now, special need, I will not be special need. He can say it depends. So the doctor don't come now. Make it help us understand that. Oh yeah, Dr. Bako. Mental need, mental disorder, and neurological stroke, developmental disorder. What will be the difference between all of those ones?
Oh, thank you very much. My people now, well done once again. As a matter of fact, since we talk about very interesting topic as for special needs and the rest.
Yes.
Because don't like who's don't talk and say this special get different type. You get some way lots of other pathological problem physically, something people are paid or treat. And some whether not just normally maybe behavioral or some of them with a mental problem as regards learning and learning disability where some of those people will come down with. As a matter of fact, when you talk about the general umbrella for special needs, it covers plenty. And I mean, when people say if you be or not, which is quite true.
Okay.
Quite true. Because if you look general assessment for what are special needs disease, the category, the neurodevelopmental problem.
Yes.
Really associated with the autism spectrum disorder.
Yes.
Of course.
ADHD,
Yes.
there's cerebral palsy and
Yes.
the rest, all of them. Those ones did there. It gets some genetic abnormalities.
Yes.
The Down syndrome and the
Yes.
rest. All of them did the other part also.
The developmental side.
Yes, the developmental side. Then because they get the neuropsychiatric part of it. You understand?
That's psychiatry we're doing now.
Yes.
Now that one.
Because
Because
as a matter of fact, na special need condition.
really,
Na special need condition.
because they will need support.
Support.
That is just the umbrella.
So the thing we say,
Any kind condition
should
We need support. You know,
Like
now
That's
initial
what we talk just now.
definition now.
we need somebody to assist that person. na
Exactly,
special need.
exactly.
Because they allow that person alone, there's high tendency in the way or waiting is supposed to do as normal person no go do.
No go fit do am.
which means say the kind of attention where they give people where get bipolar or schizophrenia, it's not supposed to different from the kind of attention when they go give person where get autism.
Yes, exactly.
Because when you say autism, they go raise their eye.
See,
But when you say
wetin be that one?
schizophrenia, they go calm down.
Because,
Calm down.
Now
Yes,
that one
you
I don't
understand that one.
understand.
Exactly.
You know,
So they really
something where
need-
you don't know, you go dey fear am.
Na
Something
so.
where you don't know, you go push am aside.
Exactly.
You treat am like say e no be anything.
Exactly.
But with this information where they come now, people go know say this one too need special attention.
Need special
Just
attention.
as schizophrenia and all other
Yeah, bipolar, all of
neurological
those things.
issues need attention.
Because me, I know say people where get schizophrenia and bipolar, they work for our offices.
Yes.
They marry, they born children,
Some of them they even win Nobel Prize.
and they get they go their medication there with them.
Yes.
Of course.
Some of them go even get breakdown. They go, they no go feed, they go tie them, go psychiatric clinic.
Serious.
But when you tell person say my baby get autism, you go be like say okay, carry and go throw it for one place.
So
You know.
maybe not because you need to take care of your people.
Exactly.
Say,
They what you do, they
you
make
know they
pikin
train
like
the
that.
pikin well.
You know they train
If
am
they see
well.
the child just dey behave, they say no go train am well. You know they beat
So
this
it's
child well.
unfortunate. Some of the education they come.
Exactly. So when I see now say my people now say me and Oga Boniface we not go medical school but we try small. Because as Dr. Bako don't talk now, at the end of the day, and Oga Boniface talk something just now, he say everybody na special need.
Everybody get them.
Everybody fall on that
Yeah,
special need category
yeah.
because one way or the other, it gets something where we need to take support our everyday living.
But the fact say we know they perfect. So.
Exactly.
Exactly.
Then people wey be say they use glasses. That glasses na special need.
Yes,
na
now accommodation where they
accommodation,
use.
accommodation.
Yes.
Glass, I no go fit read it.
You see,
Yeah.
now accommodation
Now the
where
truth
people
be
they use.
Okay, so my people, I beg make una like and make una share the link as the program still dey on now, so that people who na know will never join, may they join, because this topic na very very important topic. It will help us feel at least start to dey get that level of accommodation and empathy. You know, that acceptance. Say there is, as long as a person dey in need of something, that one not mean say that person no deserve his own dignity and respect.
Of course, of course,
You know, because people they will be say they get depression,
of course.
but they deal with their medication and they go work.
And they see go therapy.
They go
too.
therapy
Yes.
too. So
Yes.
if you can't get small pikin, where they cry, where they shout because outside too cold, in body not feel processor, or the sound too loud, if they run, if they scream, they go say you not train your pikin well.
You see.
This difference we no need them. Or you get pikin wey they read, they struggle. You see, I'm saying now THE did there, but this is a book. It go say this book. You know they see that is. Not be saying lazy, not be saying not focus. Not because of the way the brain they read down for him. So what he need something extra. Now make him fall under that category of special needs. And the thing we need now more repetition. He need extra support.
Yes.
He don't need you to shout for him. He don't need you to curse him. Say your brother feel it that why you not feel it that. He and the brother not come with the same brain.
Very wrong comparison.
And he need you to also observe. May you see other things where you go fit do, where they come easy for him. Because if I say that pikin not feel that thing, he don't they give him shame already.
Yes.
That pikin don't need to tell you say in the shame, need to tell you say in the shame before the shame go start. No. Because if they go school every day, you go talk your own for house. If papa and his teachers go do their own for school. You know, if you not come house, can't tell you.
Of course.
If friends go laugh.
Yes.
So the only place where be respite for him now be house. You too for house, you go start your own again. Say why be say they teach you the same thing over again. Forgetfulness now part of brain issue.
Yes.
People will get dyslexia, will get dyscalculia, will get dysgraphia, forgetfulness, will get ADHD, will get autism. Forgetfulness is part of the problem.
And I want just chook mouth for what you just talk now, because you get some conditions maybe say if you know they careful, if you know handle them well, especially this dyslexia, dyscalculia, it go feel lead to other mental disorders for that child.
Exactly.
You go see say the child go start to develop some kind of abnormal behavior as a response to waiting they tell them. Say you know well, your brain no correct. I know one pikin every time you go they talk say my brain no correct. And now because people don't they tell them say your brain no correct.
So the pikin can't believe.
If they talk about the boy, they say this boy leave him brain no correct. Him too he don't start to talk him. If you tell him say why did you do this, he go say my brain no correct.
Really?
I they tell you.
Which is very, very bad.
So you see the impact, the thing, these particular conditions as they face them nobody if you understand them. You they tell them say their brain no correct. Them too they go can't accept that kind of notion. Can't continue to do any misbehavior. If you ask her, you go tell you say in the brain no correct. Make you take them the way you see her.
You see, say if we take our mouth to destroy a whole human being.
Exactly.
Just now. Now the reason why we start this program, because from all of our experiences, our combined experiences, we see say pikin we get chance to live very brilliant life, in spite of the little challenges where they life, you no go fit do anything with life again. Because everybody will surround down now. What you know fit do? Now they see.
Exactly.
Now they see.
Exactly.
Now they see. Imagine, and it no matter whether sometimes now even children will come from houses where their papa mama be teacher. Now they even suffer pass.
Exactly.
Because the expectation they high up there.
Say your picky, your mama be teacher.
Oh, go be teacher. My picky not feel reading, not feel right. They nearly kill him. Not be so. Because now the one way they outside now you they see this pikin the genes way they inside your body you don't know how they take combine how all of them take waka take form this pikin. You don't know every member of your family. You don't know every member of your husband family. You don't know what they carry waka. And pikin not believe who born and they resemble. They waka far and wide.
That's why they call them family tree.
Family tree. You know? So children if you waka, you go they pick all of these challenges. They go pick on. You go see and go say, this one you go inside the family and this one you see pack. What you go do now? Now the one we carry come. Now be that. So conditions like we talk about Boniface talk just now. And that picky way they talk so if they go through depression.
Exactly.
Abi Dr. Bako.
Because as they always attack them like that, they don't get that access. They just feel say they know they
worthy.
again, what anything again. The confidence say even the need to even fight to become normal like other normal children, no need again. They say I don't even feel play with them because they are already ostracizing him from again. Exactly. When they come become withdrawn, you need to play with other children again. They come out outside again. Waiting with depression, you say what you want to always say they do them again. Before you say that, if the team continue like that, the person not enter depression. He continue like that, he will start getting suicidal ideation. Thoughts will start out. Go say to small pikin, what be the commonest thing they carry themselves out? Now through those play and interaction with their mates. Then small pikin done the day withdrawn. Say go play with your name, go sit down in his house. And every time they engage anything, go just sit down in his house.
They look.
Because you know if you go, because instead they always curse him, they always insult and say in they dull, in they slow and stuff like that. And some of those children, seriously, where all those children where you say small pikin go drink sniper.
It
happen now. It happen.
Pikin they withdrawn before he said that he go see any children go feel him inside. He go say
they useful to anybody.
Just drink poison.
And some of them they do that thing. They get that. They follow that suicidal thought on to say they want use and drag attention
to
because they know say now when they hurt themselves, people go start to love them.
So the ways that must have attention seeking.
Yes, I'll holla be that too.
And apart from that, because see now, as we talk just now, my people, me and Oga Boniface, they ask each other. They try to understand just now whether these mental conditions now the same thing as special need. But the thing what I want to make we also know now be say, even though say they fall under the category of special need because say they need people with these conditions, and I mean conditions like depression, anxiety, bipolar, schizophrenia, PTSD, OCD, obsessive compulsive disorder, and personality disorder. All of these conditions, yes, people will get harm right from the beginning. Abi, Bako, you go help us explain what these conditions be, because I want make everybody understand this mental condition. Make we put them aside, because we go come back to them again later. But the thing where I want to talk now be say, from this explanation of how pikin we get these mental conditions from the beginning, maybe it's not just the developmental condition or learning challenges. Now he gets, but after now he can't get this condition. As Dr. Bako and Oga Boniface talk, because of our behavior towards them. So this one means say our children feel develop sickness because of the way we take they handle their matter.
Exactly.
Even this PTSD, so children feel get post-traumatic stress disorder.
Yes.
Why not?
So if you hear person shout for one place, you go run. Because every time there's also shout. Yeah. Because that one are the only approach one they take to try to work on the situation where the pikin get. So yes, this our platform. Now platform to discuss mostly developmental and neurological conditions. I bet define them for them. So developmental and neurological conditions.
Yeah, developmental conditions are generally conditions where we see as pikin, as they give birth to pikin. That's what they call it neurodevelopmental. And then give birth to pikin. The process will involve the growth of that pikin, which also talk on certain things like the brain and even the nervous growth. And again, the environmental factors. As the pikin they grow, the environment where the pikin they grow from also play an important role inside that neurodevelopmental process. As the brain they develop, because factors need to stimulate from the outside, from the environment. That's why the play, just like we just narrow down how if pikin they rejected within the environment, the pikin can't get depression. That's tell you how the environment play a role even as the pikin they grow. So neurodevelopmental right from inside belly to birth and even the early years of the child as they grow. Those are the changes that happen, especially from the brain, as a result of even also the environment superimposing till the pikin become what it may be. But most of those other biological problems, like all those mental health disorders, like things like schizophrenia. We know schizophrenia now, some kind of abnormal mental health problem where we say, you see a person feel there's some of this schizophrenic when we say in get abnormal personality. You see the person feel they feel see things where you know they see even if not in the same area. If you they hear voice, where if they talk with the people self, and then they hear them, they answer them, or you didn't see or you didn't hear anything and stuff like that. So like if they say the person they see things, when they say and they talk to somebody, feel they hug the person, they call them visual hallucination. The person they hear, call them auditory hallucination. You get some say they feel crawling sensation for their body. Some you see they tell you something inside their body, say like say they put one chip inside their body. Then they see when they put the chip, and even they touch them, they feel the chip, but all they exist. Really day. So because of circuitry for inside the brain and normality don't happen inside the brain, that make them they fit see all of those things with us really see. In which if we carry them come our African context, they will say that spiritual. But really this one mostly a neurodevelopmental problem. Because with time they cause problem. Like if you can't look at bipolar disorder, it's the person gets they move, they swing between depression and mania.
So what to be mania now?
At the particular time, say the person is depressed. At the particular time, get excessive energy
and excitement.
No go feel control, overplay.
Say, today they like this, tomorrow they like this. Tomorrow they hyperactive, tomorrow they quiet. You understand? That one is entirely different from mood swing. But any mood swing way they do, way can they affect your relationship with people? That one, they don't go towards bipolar. You understand? So that's the swinging. So behavioral abnormality bipolar. Then we look at OCD. We don't even talk about OCD.
We will come back to OCD again.
Laugh, tire. Him man are part of the problem. Things where you're not supposed to overreact.
Everybody get
overreact.
You understand? Ordinarily say I carry my shed hang here. You're not supposed to cosplay. You just come carry the shed keep for the apple. But you can't repair. Or I just throw one small speck of. I remember when they talk about pure water. Person just bust pure water. Put that tiny part of pure water before you drink. Some people get OCD. They don't go visit sleep. They find the pure water inside the carpet. Till they gather come inside the house for their mind go rest. Or you just sit down to say, you go check your door whether it close up. You close your door by yourself with your key. The key video your front self. You see start up again. Go check whether the door close, come back and sit down. They watch TV, go back, go check whether the door close, come back and sit down. You say it don't affect your normal life. And whatever. So now I don't talk serious. This one obsessive compulsive disorder. And most of those things they affect that. And you say person will just day. You go say if you have to come outside, say say somebody one wound down. You will get persecutory symptoms on your head. So you know go one come outside because somebody will wound that. What way supposed to go maybe supposed to get some kind of millions. But because and the person nothing like that, now your thoughts. You know agree come out again. You go just sit down and say that's so million will pass the person. Say it don't affect your normal routine for life. So him on it. So that's where most of those things because you have to have somebody to assist in this.
Of course.
That's what we call the special needs. Because now it's not normal. Somebody have to make you understand that it's not like this, my brother. Somebody have to come and be supporting you. Epilepsies. That one are special. Because somebody get especially seizure disorder. We know they well controlled. The next thing is this person, okay, let's assume that only in the house. And maybe the source of water for that compound and region. One, if you want to get okay, just say, and you can't seizure or epilepsy you get now, what do they call epilepsy without aura? That's you don't even get the thing will give you the idea of that. Then you can't go region, they go draw water.
If you fall for inside.
You understand? And nobody there that only you the compound. So you see, say people like this, if they don't get well controlled, they need person around. If you they cook with firewood, maybe you don't get the money to buy gas or anything.
You go for inside fire.
Because I know a patient where we say the first time we see the patient, this person gets seizure. They cook with a kerosene stove. She get convulsion, falls inside the kerosene stove. Fire they burn her. They have to amputate the leg after them bring her to hospital. She they convulsion, she never even know say fire they burn her.
She don't know.
She doesn't know. It was after the seizure.
The pain constant.
Yes. So you see some of all of this. So neurodevelopmental, yes, the autism, the ADHDs, and the rest. They on their own part. While the others also because we still need them. So these are some of the different types: the schizophrenia, the bipolar, the depression, and the rest. This was PTSD safe. You know, PTSD are like say when person don't get one important event, traumatic event for life. Okay, let's say like use the commonest people, military where they go war, carry guns and this go do war for a very long time. Don't hear bomb, don't hear everything. One day you come house, you want sleep, you know, sleep. You have to just wake up in the night like say yes, sound of bomb. Wake up immediately, okay, somebody just shout or you just hear one bang. You see the person will just
immediately
hide for back of the building. You go just run, go to hide for back of building.
Exactly.
You go think same day inside the war front. But really those things don't exist at that time. So the same thing with children, just like we talk. When they abuse repeatedly, the more you just shout, they will think say maybe next week will follow maybe that beat you. You don't go hide for one place. and it don't become recurrence, and they affect their normal daily life. So those ones are part of the process. So that is typical what post-traumatic stress disorder would be. So basically, some of those neurodevelopmental and even psychiatric components, all of them somehow have special needs, and they really need people to help them.
Yeah. Okay. So from waiting, Dr. Bako just talk finish now. We say at the end of the day, yes, all of these conditions get different names, but waiting we must see for this our society. We say we must see the human being before the condition.
Before the disease.
Exactly.
We must see. We must they think about how we go to make things easy for people where they go through all of this condition. Because I know, say, especially because when it comes to brain and mind disorders, people know they see them.
Yeah.
Unlike the one where person cut hand or cut
get,
leg
or you get fever.
or you get fever. Everybody see that one. You know. And the reason why I bring up this mental disorders now because sometimes people where they get neurodevelopmental condition, they also come down with some of this mental classification of disorder.
Yes.
As we talked just now, depression. Sometimes too, not be because the pikin not get loving environment. Sometimes if you just be say now that condition we get, now it just a follow come. Sometimes if it be the medication side effects.
Yeah. All are possible.
Like all this autism now, for example, if person, because all of these are neurodevelopmental conditions, they get levels, as we talked just now. You know, we get the what is it they call them now?
Mild, moderate,
The mild, moderate, severe, and profound.
Profound.
We go talk about those ones later. So, for example, now autism now we be say get them at mild level. Even though we call them mild, that one not me say not be problem.
No problem.
I be Ogun Boniface.
Exactly. In fact, if for the case of mild autism self, they go need special attention.
Yes.
Because if you just integrate them with the regular children inside one class, they cause trouble. In fact, they don't go feel learn the way other children they learn.
Yes.
You go need to associate with them with some accommodations.
Yes.
Maybe say you go tailor to their own needs.
Yes.
Maybe say they go help them for inside that class. So for the case to be mild, no be say he no need help. No, he need help, but he go need small help. Just as the thing, they go mild, moderate, severe. Now depend on the thing they determine the quantity of help.
The quantity of help
and attention with the person.
And sometimes, from my own knowledge and experience, those people with these mild levels, most time now they suicidal because they get enough understanding to understand, say people know they treat them well.
Yes.
They get enough rationality.
Yes, they get better insight.
Yes, they get enough understanding to make that judgment and to get that massive expectation.
Exactly.
So when that expectation not reach waiting that they see others will not get their condition they get, if it can result to that sense of lack of self-worth and lack of what do they call them now? What is this word now? Self-belief, self-esteem.
And subsequently depression.
The subsequent depression. Some of them will come down with this like eating disorder.
Yes.
In fact, I get one experience with a client where I don't work with.
Okay.
An older adult.
Older adults. Now they talk so not even small picking.
Maybe small picking. He gets issue with cluttering. Maybe say if
what
he
be
talk,
cluttering now? Define cluttering.
Cluttering be a situation where we say person they jam pack in sentence.
Okay, cluttering for speech.
Yes, for speech.
Because my head go cluttering to the practice for one place.
I dey use from my own field
okay,
now.
Cluttering for speech. Okay.
For speech, where we say if the person talk, just he want tell you once, maybe he want tell you something for one sentence. You don't go even understand one word. But he don't pass the information. You go say, he go talk am again. You go say, I don't understand what you did. I talk slowly. Now that time when you go understand that. And as I dey relate with this client, he can't tell me, say, I can't realize, say, this thing they affect in relationship with other people. If they affect in relationship with him, family members, if they affect in relationship with himself, with his friends, and so in the day unusually withdrawn. You go see him, he go just withdraw. Why? Because he know one person in they talk to person go say, wait till they talk. talk well and talk more. You understand? That kind so he go just withdraw. No be say in the him attitude, but he dey force am onto himself because he get that issue. Now until we start to dey work with the person, we can't see he sabi express himself. And
he just needs to
he
go
just needs he needs special attention
to help and get that
clothing
level.
issue. Yes.
He may talk at a particular pace.
Yes, exactly. And as he get attention, he affect even in business, even in friends, even in relationship. So you see, all these conditions, they need person, make the person step into the situation, come offer some level of attention, some level of care. We be say as you give that care, you go help him start to live in normal life like he's supposed to.
But very importantly, you know, if all of us did this life, all of us did this world, and we will talk, say we well, we not go fit sit down on our own, get everything by ourselves alone,
Exactly.
do everything by ourselves alone. Why it hard for us to get patient with others? You understand?
Exactly.
Because if person they stammer, I go expect say we get enough pity, you know, enough empathy. Not even pity now, because the person engage himself for waiting they legal. He not thief. But the only problem we get is say he need more time to make that sentence.
Exactly.
Why all of us not go fit train ourselves to expect to treat others the way we would expect me them treat us? Because sometimes most of the problem deal with us where we say we well more than the people who get this condition.
Exactly.
Because we just forget say they be human being.
Exactly.
We not get the time, we not get the interest to even wait extra. Meanwhile, if now we they run follow something, if they say wait 3 hours, we go sit down with that wait.
Yes, now.
If now let water they there, we go they drink water.
The wait.
But we not go fit get that small time. And if we not train ourselves to wait, give chance to other people, it go affect us for areas where we not expect.
Exactly.
Because you see this patience, so it is very, very important. And patience not be only for what you want. Sometimes now for you to just help person get what you want. Because for that part, you say we can realize, say, oh, this person not be saying no more as soon as they talk since. But you just need that more time. Because especially when they do business, but they rush talk.
You go fit get customers.
You feel that's but they supposed to wait, say, okay, okay. Even yourself go help the person make the sentence, say, okay. Because you know, and this is a very, very interesting thing. I know say people they come up from Nigeria, go countries like China. People say those people know they speak English, Finnish as they speak. We will not they speak Chinese. You know what they say they buy? They go buy things with full container with calculator. I'm not kidding. They go just say, I want this. They go say, okay, how much the person go? They enter the amount for calculator, show the customer. Customer go take calculator, say, no, this amount I want. That's why they go take calculator, talk, they go agree. They go full container. All the way from China to Nigeria with calculator. Yet, some of these people, they feel engaged like this with outsiders. And they get family members with these conditions. They don't feel standing.
Exactly. And it gets something I want to talk, just to add on to what you don't talk now. Waiting we need, like what you talk, no be pity. We no need to pity these people.
I'm telling you.
But we need empathy.
Empathy.
Maybe empathy means
support.
say yes. Empathy means say you put yourself in their situation.
Exactly.
How you go feel if I treat this person? If they treat me like this,
yes.
why they treat this person? How I go feel? And make I tell una, make una remember say, if as God give you life,
yes.
As we dey pray for many years, make we live long for this earth. As God they give you life, one day, and you they grow older. One day you go get special needs too.
Exactly.
Also.
You go need person, make person assist you.
Yes.
Do some things. Even the Bible talk and say, now when I'm old, someone will now carry me by the hand. He will carry you by the hand, take you where you no want. Because you see, say the thing they very close to you. closer than you even think.
Yeah, that is this
Yes,
need
this
soul.
special need
This special
get
need soul.
closer to you than
It there
you
is
even
all
think.
of us.
So if you know, come, they put yourself in other people's shoes.
Yes.
When you go there, that kind of situation, how you expect other people may they treat you?
You know, make I
big
share this story
question.
with you now. You get this girl, she get Down syndrome. I'm going to talk about all of these conditions by God's grace for more episodes to come. But I just want us to talk about this special need, what it be. Because if you just talk special need, people could just look at one disease.
Yeah.
You know? People will even get cancer, they even get pity past person will get autism. Really?
Yes,
Yeah.
exactly.
And it's ridiculous.
All of them are things that are
It's
need
ridiculous.
attention. All of them need attention.
All of them across the
There's
board.
no doubt about it.
You need support. One condition not deserve more support than
Than
the
the
other.
other. Mhm.
Everybody they're supposed to get their required level of support. So as I talk, they come. This girl, she get Down syndrome. Of course, her parents know they don't want her around, so they carry her go meeting grandma. Now with the grandma the house. Grandma get a diabetic patient, so the grandma they need to take sugar sometimes to help her insulin. This girl will get Down syndrome where her own parents no want around. This girl they observe the grandma. Say, my grandma they go this corner, take this thing, it dey take her. You know? So you can't get that time, that day, this woman go into shock.
Sure.
And she needs something sugary to help her regain herself. Now this girl with Down syndrome, now I save that grandma.
You see.
Not be me talk the story, now nurse, will they take care of that grandma? I narrate the story. That girl, this, as they watch, and that's one thing with persons with these conditions.
Exactly.
The the strength we then get, we no get her. Because that's one thing where they focus on. They go know her from
They will know
beginning
very well.
to the end.
Anything where they know very well, they know them today. And I make you say most
Because
of them are
they enjoy that focus. We know they feel they focus continuously
too
like
long,
that.
you go don't tire, waka.
Don't tire. But then they tire. That is why they are very, very good once you help them identify where their strength be. You understand? And we need those different way of thinking.
Exactly.
All of these countries where we say they're better pastors, now all of these different brain, now I help them.
Exactly.
I come across, it don't take for me or person because I never come across actual comment from Bill Gates himself, identify himself as person way there on the spectrum until 2 days ago. I don't know whether they find worker for Instagram. I can't see this short video about him where they talk say there is high chance say in the on the spectrum. He say in spite of all of the other challenges we gets, this love for this IT when he develop, he say he no go trade them. Why he go trade them? Now this IT love will develop like carry rich way there so.
Exactly. Exactly.
And
If you dey use Microsoft, if you dey do use Microsoft Word today, Excel, PowerPoint, every time we use it, they put money for a pocket, and that person will get autism be that.
Exactly.
Okay, you know they use iPhone. People go take million they buy iPhone. Steve Jobs get dyslexia.
Yeah.
Any people will get dyslexia. Their visual skills now on another level.
And now because say they give them the
Chance.
special attention where they need
They help
at
them.
the times they need them.
They need them more.
As they give them those special attentions and special care, you go see say they fit do extraordinary past even the
Yes.
average person.
Yes. Because you know this I don't know whether you know about temple grandin. I know you go know about temple grandin. I don't know if you know, but they call her the grandmother of autism because she's a professor. She's in her 80s now.
Okay.
Now time that her days, now the days where they lock them for prison. But her mama not agree. Mama really support her. Get speech teachers. We help her with talking and all because she get photographic brain.
Okay.
She mentioned one word one time when they interview her. He said, you know that Fukushima nuclear disaster will happen. He said the reason will happen is because they did not get any person where they think differently for their team. He said he get one thing when they're supposed to. She mentioned the place where they're supposed to put that thing. No matter the earthquake or anything, no will happen. Nothing will touch that nuclear plant. He said, but people where they think straight like us, they don't go fit think like that. So we need all of this diversity.
Exactly.
This different way of seeing things. to fit a build the kind of society where we say we want build. All of us, they think the same way. How we want a waka? Everybody go for inside one hole.
Exactly.
Because on the same road now we they see. But if we get, this one say no, I see her from this side, we see where I see her from this side. This one say no, I see her from this side. Now it's okay, fine. We'll bring all of these sides together.
Exactly.
Look, now that one might be innovation.
Yeah.
Exactly.
So my people, for una house, when picking, when I don't see say it different, when they suggest something, when I listen to them, when I give them space, make it do them. Because the way when they see it different, and that may be the solution to all of the problem when they try to fix at that time. When I meet person, people where they interview people for work, when I not get only one criteria. When I try to understand people from where they come, work with their ability. Una go dey surprised wetin they go deliver to una. And book, write for book, read for book, not be the only thing we did this world. It's our hands, so if we bring many things come out. Abi allow Oga Boniface.
No.
Vocational skills.
No,
Now very, very important part of our everyday living. And vocational skills not be until when you go outside, go learn them. Every day we dey do vocational skill for inside house.
Yes.
Now you be cooking. Yes, the kitchen. Now you be cooking. Now you be cleaning. Even ironing. You know, if you do hotel management course, now different way they take the lay bed. This bed where they lay for hotels.
Yes.
Now,
You see, I'm fine. Like say, make you know, lie down on top.
now skill.
Exactly.
When you go learn how you go fold. You know, this clothes where they fold. Now different style they take they fold clothes.
Yeah.
Exactly.
Where you go maintain that crisp, quality of that
Material.
structure, and the way where you go take for different materials.
Exactly.
All of these things, they may look dismissible, but no, they are very, very important. Even people where they feel they cut things on a very straight line, not everybody feel do them now.
Exactly.
And that matter in so many places. Because it will reduce waste. It will help you get defined structure as you want them.
Exactly.
So, my people, today conversation now more of trying to help us understand, say, all of us now get special need, first of all. The only difference is some people get and pass each other. And because they get and pass us, we feel do plenty things past them, not missing their life, don't useless. Those of us where we say we feel do many things with our life, now our job. And that job now God give us, because now test. You know, what we they enjoy? Now both enjoyment and test. As you talk just now, we they enjoy easy way of doing things. But one day we go grow old.
Yes, of course. We'll grow old.
That enjoyment, we go need person at that time. Exactly. We go need that time. We go need accommodation, we go need support, we go need all.
Yes.
You know? So now the time where we go give so that we go get back.
Exactly.
When that time come. May we start with how we they talk. The language where we they use around people. We God already the test with what we get, and they no get her. If you not do with money, do with your mouth. It better make you not say anything that you call person picking mad. Or you gonna say why that picking they shout every day. Instead, ask him, Mama, madam, this picking be like say it matter, easy for you. How you choose feel help? What did they do this picking? Maybe I go feel make 1 or 2 contribution. That's a better way.
Better approach.
Then you go just do the picking, say, this mama I no go fit talk. So if you know say you not get the mind or you not get the ability to use your mouth to help person, not talk anything.
Exactly.
Just waka, do your own thing. Because the God will create him, it go help him one day. Now you just lose the opportunity to get reward. Because if you not do anything, God will do his own thing.
Yep.
Exactly.
At his own time. And when you do something, even if much not come out, it no matter.
Exactly.
Now make you do it. Now be the most important thing. And Papa and Mama, family members, I beg you now. Now they destroy our own before outside destroy them. If outside they drive them come, may we let their home be place where they go feel get support. I no mean say bad behavior now equal to special need. No. All of us know waiting be bad behavior.
Yes,
and waiting, when person they do something over and over, that person not feel control what they do. for different environments. This one don't become problem.
Of course.
Not say the person they deliberately they do exactly. But when resources don't there for that for person, you don't put things where that person go fit when you fit help that person, you don't put them around that person. Yet that person understands enough for him. But you use them, but the way with that person they continue to respond after you don't make your own support, you not be waiting you go expect from them. You know, and you don't caution them, you don't support them, then that one not be special needs. That one maybe beginning from ingratitude upwards. From ingratitude upwards, because when it be your own, you know you understand that you go define them. But to can't even come around to your own way they try to another one. So these are two different things where we talk about. Exactly. So, but that is why we always talk about assessment, going to professionals. Now they go help you assess this person, go help you differentiate them. Say, okay, no, this one a condition we need support. This one we're not sure in a condition, but this pikin needs support anyway, because if you continue with this behavior, if you can develop condition, we need support. It's true, because bad behavior they become condition. Exactly. I be Dr. Bako. Exactly. Now you be neurologist.
Very much possible. Because when you keep reinforcing certain things,
yes,
you become habitual.
Yeah, you become character.
You become character.
And once you become character, you know go let live again.
That's a problem with already know, because that's how the person will see saying be numb, while other people they say I'm saying they are normal.
Okay. So at the end of the day, what do you not feel understand? May we try the go specialist. May they help us understand that, so that we go start to help our children, our family members, try to encourage our neighbors, our fellow mosque goers, church goers, people around us, help them to think, say, okay, oh, this one don't pass you now, not stay house again, go hospital. Exactly. May they help you understand, and you go know how you go to get support and continue to maintain support. So my people, it be like say they don't tell me for years since. Say, yeah. Okay, no problem now. We don't talk today. Una do well today. Oh. Yeah. I hope say una learn one or two things. Because as I talked before, I just really feel say make we talk about this special needs. Make we really talk about what it be. As from next week, we will start to talk about them one by one. Not be all of them with the support for this Beautiful House NGO. No. Now only the neurodevelopmental conditions. But the reason why we talk about all of them now, because say sometimes person will get neurodevelopmental condition if he gets mental disorder. Yeah. And person will get neurodevelopmental condition if he get physical disability. Yes, like cerebral palsy now. Person will get cerebral palsy if he gets neuro condition, if he get developmental condition, if he get medical condition, if he get medical condition, can't get physical condition on top. Only one person. So we not get it right to then make them and their family feel bad on top of the one we they don't already do. Yeah. We don't get that right at all. Exactly. We don't get that right. We not get that license to behave like that. If we know we help them, waka past them. Mind your business. I beg. Make we support people with good words, with love, with kindness. Money not be everything. Word, sometimes a big pass money. Prayers, that person don't need to even know so you they pray for her. A big pass money. So my people, now maybe Mrs. Afiz Modupe. Huh? Where from start to Mr. Afiz? Mrs. Modupe, this is my husband name confirmed. No. I'm Mrs. Modupe Afiz Ogun, CEO, founder, Beautiful House Foundation. So Dr. Bako and Ogun Boniface will say their own bye-bye.
Oh, thank you for people. At least I believe the general term of special needs, we don't hear about them. Thank you for listening to us. I'm Dr. Bako once again. Subsequently, I believe so we'll start talking about each of the special needs so that we will at least get more information about them. Thank you very much, my people.
Okay, my people, just to add before I go say my own bye-bye, I just want to talk to school owners.
Yes.
School owners. So far you don't identify, say, you get some children where be say, or some students where be say they get special needs. Wetin suppose they come your mind be accommodations. Start to plan accommodations. Things where be say you go provide for them, resources where you go provide for them, therapies, resources,
Yes.
even materials they we be say you go buy especially for their own needs, where they tailor to their own very specific needs. So as you be teacher for inside class, as you be school owner, once you see say kai this child he get as he be, you know they follow, you know they go the same way other people they go, you know they learn the same way. Waiting suppose they come your mind now accommodations. Waiting we go fit provide, which kind of environment we go fit create for this child make it learn. I still remain Boniface Chukuka, and I be speech and language therapist and also a special educator. And I thank Una for tuning in today. I believe say Una enjoy and well. Yes.
So my people, just to add briefly to what your guy Boniface talked just now, in particular to school owners, I beg, school owners, I know say Una they run expenses, but at the same time, these children will do in our school. Now there are most of the impact for their life for start.
Exactly.
Make una not do shortcut. Thank God now, this program day here, this NGO day here, una they see these different faces. If una need support, our number day there. Call the number, send WhatsApp. If you call, you know, but nobody pick, send WhatsApp. Leave message for Facebook, leave message for YouTube, leave message for Instagram. We go get back to una. So that if our teachers need more training, we go organize her for una. If our students not say they need resources, but I don't know what they need, we go discuss them with una. Muna not follow una mind to ruin every children's life. Because una start school to develop children, make una not ruin their life. God bless.